Welcome to my award-winning podcast, Brilliant Brains and Beautiful Minds. I'm your host, Melanie Bernicle. It's Breast Cancer Awareness Month, so we've got a couple of special episodes headed your way. This month is all about breast cancer awareness. And today I'm blessed with the presence of Nikki Cirillo. Welcome.
Hello, thank you for having me.
Thank you for joining. So Nikki, can you talk us through what you do within your career?
Okay, so I started off my career as a cosmetic tattooist, so offering the services of eyebrow, lip and eyeliner tattoo.
Yep.
And then I wanted to expand my artistic skills and really want to be able to help people. And then I studied paramedical tattoo, which entails 3D nipple and areola tattoo on people that have had breast cancer. And it also includes scar camouflage, dry needling or hairline tattoo.
Wow. And so when you went from your normal cosmetology into the paramedical, what was drawing you to take it to that next level?
Yeah, so honestly, what I really wanted to achieve was restoring confidence in people that have had trauma in their lives due to the cancer. I wanted to give them back something that was missing on their body, and I wanted them to visualize that through the 3D effect.
Now, Nikki's actually created her own amazing 3D nipple areola. This is unbelievable when you see the pictures, which will pop up for you as well. It's mind-blowing how realistic and your creative skills to be able to do that. It's art. Can you talk us through the process, how that came about for you?
Absolutely. I've always had an artistic flair, and I've always loved drawing. And so when I started on my work with cosmetic tattoo, I always knew there was so much more out there that I could do with this tattoo machine. I attended some art classes to learn different techniques, and honestly it's practice in order to be able to achieve that protruding nipple. I've designed a three-dimensional look where you shade it, color in the areola, and from whatever angle you stand at you can actually see a protruding nipple. And being able to do that for somebody is just, I just get such a personal thrill from that.
Oh, I can see the actual emotion that comes up.
It's the reaction from, the clients, it's beyond.
You're working with lots of different types of people who've been through a lot of different traumas. Is breast cancer one of the main traumas that you're working with within the area?
Absolutely.
Yeah.
Absolutely. Look, I work with, burns victims or people that have had surgical scars, facial scars, scar camouflage, or, anything that makes them feel not whole. So predominantly it is the breast cancer, because when you've had your nipples and your areolas, taken away from you, it's then, you may have not been in love with your breasts beforehand, but once they've been taken away from you, that's when you really feel like you're not whole and you're not, yourself.
Yeah, and is that the type of things that a lot of people have said to you after they've been through their treatment, that they just...
Yeah, absolutely. I have had messages, with, women saying, I didn't realize I had psychological issues until after I've seen you and had the tattooing done. I want to feel complete again. I didn't think it would bother me until, a few years later. Or when I look at myself in the mirror, I just feel bare and naked. And that's the sort of most common type of responses I get.
Wow. And then, so once people have had your procedure done, what's their reaction?
Oh, this is why I do what I do. That reaction is what, just gets me up every morning. Firstly, it's shock. They just can't believe they can see what they see, but it's more days after and weeks after when I get the messages, and when they say they have a shower and they can actually see something, or when they put a bra on they can see, a nipple and an areola. That's the reaction predominantly afterwards, weeks afterwards, when they really start to feel their mojo again.
Yeah. I think that's an amazing gift that, you obviously you've worked hard to be able to create something that's, such a personal part of a woman and their expression. And I guess everyone's different as to what makes them feel whole, and what, and I think everyone would have such a different emotional experience because everyone is built so differently. But for the people who really are connected to that part and want to see that their body can be the way it was, and it almost, do you think it almost like helps to release some of the mental trauma and physical trauma that they've held on to?
Yeah, absolutely. I am a big believer of holistic healing. It is for them. It's once they feel good from the inside, you know, they feel good everywhere in every aspect of their lives. So it's absolutely, I do think that even if they think they don't, they'd be okay without it, it's after they've had the tattoo work, it's then that they realise how much they were suffering internally beforehand, and it's then that they sort of feel, you know, normal again.
Yeah. At what part do they sort of employ you? Are you at the right end, the final stages of that?
I am, I would say, at the closure point.
Yes.
It's at the point where there are times when they've had to make a choice as to whether they want a nipple reconstruction or not. A lot of the women have decided that they don't need or want further surgery. They're tired from it.
Can I ask, what is a nipple reconstruction, not having gone?
Yeah, so basically it's just a twist in the skin, and sort of like you twist the skin and then it sort of looks like the nipple, but it's bare skin.
Okay.
So there's no colour to it. It's very, very, very plain. So a lot of women have the option of getting a nipple and then coming to see me, and then I colour in and create the 3D effect. Even though they do have the nipple, I still have to create that 3D look. But some women choose not to have a further surgery.
So that's an extra surgery after an implant.
Absolutely, yes.
Right. Okay. So that's why what you're doing is creating that, if they're not wanting to go that extra surgery, because by this stage, like I know, talking to someone who's recently going through a lot of surgeries, that they kind of get to a point where the body's like, I need a break. I've just done chemo. I've had this surgery. I've had that surgery, and I'm going to have another.
That is exactly what they say to me. I just cannot have another operation. It's fantastic that they have that choice to be able to get the tattoo and the 3D nipple effect, rather than having to have, the surgery again. Whereas some women are happy to have the nipple reconstruction and then come and see me, and then we, work on that. However, I just wanted women to realise that they have options and they have choices, and that's when I come into it. And I do come into the end. It is nice to finish it off for them in that way.
Yeah. And I think, within that closure, there's so many people who can be great at what they do, but I think also when you've got, just from meeting you today, like your personality, and you're just very kind, and like the first thing she did was ask me if I wanted a cup of tea, was making me a cup of tea, and I'm interviewing her. But I think someone with that natural nurturing ability, I think it would be important to have the right person, as well as being great at your craft. I think to be finishing off that part of your life at that level with someone like yourself would be a really beautiful moment.
A lot of my clients who meet me for the first time, I can see they're quite nervous, they're tired, and it is really important to have that type of personality and be empathetic and really respectful to them for what they have gone through. And you need to build the trust, and once you build the trust, make them feel they're not just a number, but they're important to you, and that's really important. It really does make a difference.
Yeah,
it really does.
Can we just, going back into the actual procedure as well, is it painful to have that part of you tattooed, especially after you've had surgery? And is it painful for people, or is there ways to deal with the pain?
Absolutely. Look, I have had women who have had no pain during the whole tattoo process. There's numbing cream that we can put on beforehand, and numbing gel during the process, but a lot of the times the women actually don't have a lot of sensitivity in that area, and are quite happy to just keep going. And we talk a lot through it, so as we talk through it, they tend to forget that they're getting a tattoo, so it just they relax.
And can I ask, would you do it all in one session?
Yeah, I would do it in 2 sessions. So the way I work is that the first appointment is we talk about the pigments and we colour match, and then I create the outlining of the nipple or the areola, and then we sort of work on that and implant that into the skin. And at the 4 to 6 week touch up, we go through the same process. If they want to make any changes, minor modifications, not too many changes.
So it's like little tweaks.
And then we do that at the second appointment. And if generally 2 appointments is enough.
What's a rough price guide?
It can range from, $500 to $1,000. It depends if it's a unilateral a mastectomy or a bilateral, so that's one or two. Some women who've managed to keep the areola, they just have lost some colour, so we just sort of, add some more pigment to that. So it ranges from about $500 to $1,000.
I think it's amazing what you're doing, and I think it's definitely art. And when you see, beautiful art, and then knowing that you've got something that someone's cared about and made specially for you after you've been through that trauma, I think it's just really great what you've created.
Yeah, thank you. It is an art. It's a skill. It does take practice and practice and practice to perfect it. It's just out of this world.
Oh, I'm so grateful for you sharing that, and I hope everyone out there, whether you're going through breast cancer or whether you've got friends you're looking to support them, and just the different options that we are lucky enough to have available in the time that we live in, and that we do have so many survivors. There's ways that you can look after yourself on whatever's suitable for you and what makes you feel good.
These women, they're warriors, and I'm so grateful to meet each and every one of them.
Yeah.
I'm very blessed to keep my creative flair flowing, as well as meeting such amazing people and doctors and the surgeons. I'm very blessed to be able to have connected with such amazing people.
Yeah.
Including yourself.
Well, I think they're blessed to have you.
Oh, thank you.
I'm very blessed to have you with me today.
Thank you.
Yeah,
thank
so
you for
grateful.
having me.
Oh, thank you for joining us. Thanks, guys.
Bye.
Thanks for joining this special episode of Brilliant Brains and Beautiful Minds. For all the information, head over to www.beautybossbusiness.com. See you next time.